Did you know the objective of this lecture is to introduce you to certain key things you will learn should you choose to major or specialize in the field of nutrition, especially human nutrition. This lecture should be important to you if you are a student or a person who is interested in biological sciences, nursing, midwifery, public health, medicine, chemistry, nutrition, dietetics, health and safety, general and medical laboratory sciences, pharmaceutical sciences, agricultural sciences, food science, and so on and so forth. Ladies and gentlemen, in another lecture, I may share with you the result of my research work on the position of the contemporary expert on the role of nutrition in health promotion and disease prevention programs. Today, it is truly a commonplace, and most people can be helped to accept the fact that a healthful diet and wise food choices are critical components of promoting the health of individuals, families, communities, and for that matter, the general public, and thereby reducing the risk of chronic diseases to a significant extent. The truth which each and every one of us here in Africa and all other humans throughout the world need to know is that a substantial proportion of healthcare related resources, human resources, and man hours lost at work could be saved, avoided, or prevented by merely expanding public health promotion programs as well as disease prevention programs which target dietary revolution among contemporary human beings. Take note of the fact that the expression dietary revolution under consideration refers to dietary modification, change, or perhaps transformation. Thankfully, you can afford in your journey to a venerable scholarship or scholarships to find a university course or several university courses which are related to the area of nutrition for health promotion and disease prevention. To begin with, you will realize that a course or courses related to nutrition for health promotion and disease prevention will certainly cover 1. The fundamentals of normal nutrition for optimal health outcomes, and 2. Evidence-based as well as result-oriented diet for a variety of human pathologies or diseases. You sure will be exposed to the basics of nutrition science, and then you will go on from there to build upon these to learn, discover, explore, investigate emerging diet therapies, to analyze, critique, or comment on nutrition research, and eventually to plan or help plan well-balanced meals and diet interventions for both healthy individuals and those with certain diet-related diseases and health or biomedical conditions. So, what should you expect to learn through a module on Introduction to Nutrition Science? Did you know they say that you are what you eat? I do not know about you, but I believe them. And if it is true that you are what you eat, then it is good that you do something or everything you can to know something about what you need to eat and how to eat. Yes, if it is true that you are what you eat, then it is good that you do everything you can to know something about what you need to eat and how to eat it. Ladies and gentlemen, there are many people who do not know how to eat, and they truly need to be helped to know how to eat. And you can painstakingly and joyfully learn how to eat and become part of those who will help facilitate the learning of people on how to eat. As part of your exploration of the field of nutrition, in order to help you take your place as an expert who promotes health through proper nutrition, among other things, you will learn about the field of nutrition science beginning from the fundamentals. And as you progress, you will learn the advances in or of nutrition research. At the early stage, you will learn some important terms which are intended to set the stage for your exploration and enjoyment of the course. I am sure that you will enjoy yourself a great deal when you get to another stage where you will be expected and required to take a look at meal planning guides and tools around the globe to provide you with a great opportunity to assess and to determine or establish, for example, your own nutrient needs as an individual. As part of your exploration towards becoming an expert in the area of nutrition for health promotion and disease prevention, you will get the opportunity to enjoy a course on heart and blood vessel diseases. You can call them cardiovascular diseases. That is, the cardio refers to the heart and the vascular refers to the vessels. Did you know nowadays heart disease is the #1 cause of death globally? It should interest you to know that your own food choices make a difference when it comes to the kind of cardiovascular diseases which you may suffer or prevent in your lifetime and that of your own descendants. This is the reason why it is good that you are expected and required to study the risk factors for cardiovascular diseases and delve into various dietary avenues for the prevention, control, and or management of heart disease, hypertension, stroke, as well as hypertriglyceridemia. Ladies and gentlemen, diabetes has now become a major global public health burden. Some authorities have estimated that 438 million people, or approximately 8% of the world's human population, will suffer diabetes by the year 2030. This is one of the most important reasons that you should love to explore the role of nutrition in the prevention and management of pre-diabetes, type 1 and 2 diabetes, and gestational diabetes. Indeed, you should be glad to enjoy the exploration of evidence-based recommendations for physical exercise or activity with diabetes, meal planning, carbohydrate counting, and the important roles of dietary fiber and the glycemic index in blood sugar control. Such knowledge will definitely empower you to strive to control your or to contribute your quota in the prevention, control, and or management of this menace among your family members, community members, tribal or tribe members, citizens of your nation and continent, and the world at large. I repeat, such knowledge will definitely empower you to strive to contribute your quota in the prevention, control, and or management of this menace among your family members, community members, tribal members, citizens of your nation and continent, and the world at large. You will also be expected and required to explore the cancers. Ladies and gentlemen, the study of cancer is called oncology. Did you know there is the need for you to appreciate the fact that diet and cancer are linked, and there is a need for you to help people recognize this fact? You should also strive to understand the extent or degree to which food intake impacts the development and progression of cancer. One day soon, it is possible that you and or some of your age or course mates may be among those whose research works will help us to understand the degree to which food intake impacts the development and progression of cancer. Did you know, as part of your preparation as an undergraduate student, you will be expected and required to learn about the diet-related risk factors which are involved in cancer development, as well as evidence-based guidelines for the nutritional management of cancer, besides treatment-related side effects. As facilitators of your learning, we will continually seek to help you to appreciate the emerging cancer nutrition research and to help you to do well to debunk the various human diets and cancer mythologies or myths. Another important thing that you should appreciate is in the area of obesity and body weight management. Did you know global statistics for the obesity menace did not exist some 5 to 7 decades ago, counting from, say, the year 2020, 2023 or 2024? When you watch the early Ghanaian, Nigerian, South African, Angolan, and other African movies, you certainly will appreciate the fact that the continent of Africa was absent obese people. Yes, the continent of Africa was absent obese people. This may explain why at the start of the emergence of obesity, people who became obese in Ghana, for example, were referred to as Obolo or Obolobo. Those people were few, and many families, clans, communities, tribes, or ethnic groups did not have people who could be referred to as being obese. Today, when you enter into many houses, communities, towns, villages, marketplaces in Ghana and shout Obolo or Obolobo, either many people will respond to you or they may not mind you, because Obolobo or Obolo is no longer a unique name to a unique people in Ghana. Many people have evolved into obese people and therefore are suffering from obesity. Ladies and gentlemen, we have gotten many obese generations in the last few years, and they have actually given birth to obese people. Can you imagine that? Africa, why? How? Today, the magazines, the libraries, the journals, the internet, and so on and so forth are exploding with obesity statistics. As part of your effort to establish yourself as a nutritionist who is also interested in health promotion and disease prevention, you will be expected and required to, one, to study the complex and interrelated factors which contribute to rising obesity rates in Africa and around the globe. 2, to explore and discuss various tactics to body weight loss and body weight maintenance. And 3, to plan for future solutions to this global pandemic. Yes, the obesity is a global epidemic. The obesity is a global epidemic. And so you'll be expected to plan for future solutions to this global epidemic. And and you need to take your place as professional and help us to overcome it with confidence. Yes, you need to take place or your place as professional and help us to overcome the obesity with confidence. Ladies and gentlemen, as part of your exploration of human biology or basic biology, you learned about the gastrointestinal tract. Note also that as part of your preparation for a profession in the area of nutrition and health promotion campaign and disease control, you will be given the opportunity to explore the disorders of the gastrointestinal tract. Did you know it is a common place that a healthy digestive tract is vital for optimal nutrition status, and each individual in our communities must attain an optimal nutrition status? The very sad news from the scientific journal article is that impairment in any segment of the gastrointestinal tract of a human can swiftly undermine the integrity of proper or efficient nutrition digestion or nutrient digestion, absorption, and nutrients. I repeat, the very sad news is the very sad news from the scientific journal articles is that impairment in any segment of the gastrointestinal tract of a human can swiftly undermine the integrity of proper or efficient nutrient digestion, absorption, and utilization. This is one of the most important reasons you will be expected and required to know how a healthy gut should work and what is expected and required to be done when the digestive process is disrupted. At the undergraduate level, the specific gastrointestinal areas which you will be expected and required to explore include: 1. Celiac disease and gluten-free foods. Did you know celiac disease is an illness which is caused by an immune reaction to eating gluten? And gluten is a protein found in foods containing wheat, barley, and or rye. In case you have celiac disease as we speak, and you choose to eat gluten, it will trigger an immune response to the gluten protein in your small intestine. Over time, this reaction can damage the lining of your small intestine and prevent it from absorbing nutrients. This is a biomedical condition which is referred to as malabsorption. Number 2, diverticulosis. That is a biomedical condition which occurs when small pouches or sacs form and push outward through weak spots in the wall of the colon. Number 3, diverticulitis. That is an inflammation in a person's diverticula, which are small pockets which can develop on the inside of the colon. In other words, diverticulitis happens when diverticular tear, leading to inflammation and at times infection. You will appreciate the fact that Diverticulitis can cause severe abdominal pain, fever, nausea, and a marked range in your bowel habits, or I beg your pardon, a marked change in your bowel habits. Number 4, disease. That is an infection in the tiny pouches which one can get in his or her colon. The number 4 is supposed to be diverticular disease, and that is an infection in the tiny pouches which one can get in his or her colon. Remember that the pouches themselves are known as diverticular, and that having diverticular is called diverticulosis. The number 5 is peptic ulcers. That is defect in the gastric or duodenal mucosa which extend through the muscularis mucosa. In other words, you will appreciate the fact that the peptic ulcer disease can involve the stomach or duodenum. Number 6, inflammatory bowel diseases. That is two important biomedical conditions, namely Crohn's disease and ulcerative colitis, which are characterized by chronic inflammation of the gastrointestinal tract. You will note that prolonged inflammation results in damage to the gastrointestinal tract. Number 7, dysphagia, that is difficulty swallowing. Yes, some people have difficulty swallowing, and you will definitely learn to help them. Number 8, gas, constipation, and various malabsorptive disorders. Number 9, the role of dietary fibers in gut health. Number 10, the roles of probiotics in gut health. And number 11, the roles of prebiotics in gut health. Ladies and gentlemen, we will end this lecture here. At least you know how, or you know some of the key things you will explore should you choose to explore nutrition, especially human nutrition. May you stay in touch and in tune. Bye.